Hello, my name is Dr. Farman Ali and I'm a GP and family physician. Today we'll be talking about a very important topic called contraception. So what is contraception? Contraception is basically the process of taking steps to ensure that you do not become pregnant when you have sex. There are many options to do that, and they all have their pros and cons as well as varying success rates. I will be talking about the most commonly used contraceptive methods. So broadly, there are 5 main groups of contraception. The first one is called barrier methods. These include the condoms, the male and female condoms, caps and diaphragms. They provide a physical barrier and prevent the eggs and the sperm from getting together. The second group is hormone pills, patches or rings. These are short-acting methods which use the hormones taken as a pill, patch or a ring. Then we go to the next step, which are the long-acting reversible contraceptives. For example, injections, implants, intrauterine contraceptive devices called coils in common terms, and intrauterine systems. These also utilize hormones at times. The next is a more permanent method, and these are known as sterilization. Both male and female sterilization are performed. The last most unsuccessful method is natural methods. These rely on having sex when you are not likely to be fertile, or using barrier methods during the fertile times. I'll be talking about the failure rates. I will be mentioning them in terms of percentages. These are the rates, mean the number of women who can get pregnant when using that particular type of contraceptive. The most successful among them is the etonogestrel implants. They have a failure rate of 0.05, which means that only 0.05% of the women using this implant can get pregnant. The next one is the levonorgestrel releasing intrauterine systems, or in common terms called as the Mirena coils. They have a success failure rate of 0.1 to 0.2%. The copper coils or copper intrauterine contraceptive devices, 0.8% failure rate. Combined oral contraceptives, which is called the combined pill in common terms, or the mini pill, which is called the progesterone only pill, have a varying failure rate somewhere between 8 and 9%. Contraceptive patches, which are applied directly to the skin, they have a failure rate of 8 to 9%. Injectable progesterones, which are given every 8 to 12 weeks, they have a failure rate of 3 to 6%. Male condoms, they have a failure rate of between 15 and 18%. Withdrawal technique, which is practiced, has a failure rate of 22 to 27%. If a woman does not use any form of contraception, they are likely to get pregnant. 85% is the failure rate in that case, which means that 85% of the women will get pregnant within the first year of having unprotected sexual intercourse. I'm going to talk about combined oral contraceptive pill, also known as the combined pill. Now, the way this pill works is that it suppresses the synthesis and secretion of the hormones called follicle stimulating hormone, and it also reduces the surge that is needed around the middle of your cycle of the luteinizing hormone. And these two actions inhibit the development of the follicles in the ovaries and hence prevent the ovulation. They also have an additional action by thickening the mucus that is present at the cervix of the uterus, hence making it difficult for the sperm to get in. Another action that it does is it inhibits the implantation of blastocysts, which is a fertilized egg, and hence reduces the endometrial receptivity, which in other words means that the lining of the womb is not as receptive as it should be. So, when can you give combined oral contraceptive and when you cannot give? New moms less than 6 weeks after the childbirth cannot have combined oral contraceptive. Smokers above the age of 35, and if they are smoking more than 15 cigarettes a day, should not have the combined oral contraceptive. Women with high BMI, which is high body mass index. People with hypertension, current or past history of clots, which is called venous thromboembolism. People with heart or liver diseases, previous stroke or mini stroke, also known as TIA. Women with headache, these are headaches which have focal neurological symptoms, and the ones with aura. Breast cancer, if somebody is having a breast cancer, they cannot have the combined oral contraceptive. Patients with diabetes, it is not recommended to have combined oral contraceptive. So what are the benefits of combined oral contraceptive? They're highly effective, easy to reverse, and very convenient to use. They can sometimes bring about relief in menstrual problems. In other words, if you want to regularize your periods, this is the best contraceptive to have. It may protect against pelvic inflammatory disease. It also reduces the incidence of benign breast diseases, ovarian cysts, and there is a protective factor for ovarian and endometrial cancers, which is cancers of the lining of the womb. The problems that we face with this combined oral contraceptives, some side effects include breakthrough bleeding, which means bleeding in between your cycles, breast tenderness, mood swings. There is a slight increase of clots being formed in the legs or going to the lungs. There is a slight increased risk of myocardial infarction, which is heart attack. This is more pronounced in women with other risk factors such as smoking, high blood pressure, and diabetes. Possible increased risk of stroke, especially in those women who have migraine with aura, and other factors which may influence the risk factors. Slightly increased risk of breast cancer, but this is more pronounced in women above the age of 40. Hence, it is safe to be taken in women under the 40 years of age. There is a possible risk of cervical cancer. However, this may be related to other factors. For example, having multiple sexual partners, having unprotected intercourse without non-barrier methods, and exposure to human papilloma virus. Other most common form of contraception is the progesterone only pill, also known as the mini pill in common terms. The progesterone only pill is particularly used when other forms of contraception, such as the hormonal contraception, cannot be used. For example, women who are breastfeeding or women with other risk factors that will prevent usage of combined oral contraceptive pill. So how does it work? Progesterone only pill works by inhibiting ovulation. It is inhibited in approximately 60% of the cycles if you are on levonorgestrel containing pills, and in 97% of the cycles if you are taking a desogestrel containing combined progesterone only pill. Other mechanisms of action: it delays the progress of ovum as it comes down. Ovum is the egg in the female. The cervical mucus becomes more thickened and hence the sperm cannot penetrate that. The lining of the womb becomes unsuitable for implantation. So when can you not give the progesterone only pill? If somebody is already pregnant, patients with breast cancer or undiagnosed vaginal bleeding inhibits the use of progesterone only pill, which means that it can be used in majority of the women. So what are the benefits of progesterone only pill? It is very reliable if taken correctly. It is easily reversible and it's very convenient to use. It avoids cardiovascular risk associated with the estrogen part of the combined oral contraceptive. It can be used by many women with contraindications to combined oral contraceptive. Few medical conditions may restrict its use. It can be used during breastfeeding and it can be used up to the age of 55. So what are the problems with progesterone only pill or mini pill? Menstrual problems can occur, such as amenorrhea, which means the complete absence of periods, or sometimes breakthrough bleeding. It has to be taken at a particular time every day. The error for forgotten pills is only 3 hours. There is an increased risk of ovarian cysts and a small possibility of an increased risk of breast cancer. Where pregnancy does occur, the progesterone only pill, there might be an increased risk of having ectopic pregnancy. It's estimated 1 in 10 in those cases can result in ectopic pregnancy. A few things which are important about progesterone only pill. Number one, women call and say if they have been feeling sick or they have been sick. So if you vomit within 2 hours of taking the pill, it won't have been absorbed by your body. Take another pill as soon as possible. As long as you're not sick, again, your contraception won't be affected. This is within 2 hours. Take your next pill at a normal time. If you continue to be sick, then seek advice. If there is severe diarrhea that continues for more than 24 hours, this may make the mini pill less effective. Keep taking your pills at regular time, but treat each day as if you did not have the pill. The next bit is, what if I miss the pill? If more than 3 hours have passed and you forgot to take your pill, take a pill as soon as you remember. If you have missed more than one, only take one pill. This may mean that you may take 2 pills on the same day. This is not harmful to you. However, you are not protected from pregnancy for at least 2 days. Continue to use other methods of contraception, such as condoms. If you have unprotected intercourse during that time, you may need emergency contraception, so you need to seek advice immediately. If you are less than 3 hours late, take a pill as soon as possible and take your next pill as usual. Other form of contraception, injections, progesterone only injection contraceptives. This is basically the same hormone which is called progesterone, but it is a long-acting reversible contraceptive. A synthetic progesterone is injected into the muscles or into the subcutaneous tissue. So how does it work? Its mechanism of action is similar to the progesterone only pill. It suppresses ovulation. It makes the lining of the womb less favorable for implantation, and it increases the viscosity or the thickness of the mucus at the cervix, which makes it difficult for the sperm to penetrate the cervix. So what are the benefits of injectable contraceptive? They're very effective and convenient. It's one injection every 12 weeks for the types known as Depo-Provera, every 13 weeks for Cyanopress, and every 8 weeks for Noresteride. There is a very low failure rate. They can be used during breastfeeding. Amenorrhea, which means absence of periods, is common. This may be advantageous for certain women who would like their heavy periods to stop. So what are the problems with injectable contraceptives? It is not quickly reversible. There is a return to fertility time when you stop the injections. There is an associated small loss of bone minerals, also known as osteoporosis. Hence, it is not advisable in women under the age of 18 unless there is no other option. Menstrual irregularities are common, but we need to educate the women that it usually settles with time and they should be counseled about that. Weight gain, approximately 2 to 3 kilograms in 1 year, may occur. Women with a higher BMI, more than 30, may not be suitable for them. Delayed return to fertility can take up to an year, and possible increased risk of breast cancer. However, this is only a weak association with that. So we come to the next one, which is the progesterone only implants. These implants are inserted in the upper arm. In the UK, the common ones that are used is Nexplanon. It is a 4 centimeter flexible rod that contains 68 milligrams of etonogestrel. Nexplanon must be removed after 3 years, when it can then be replaced. So what are the benefits of having an implant? As we said earlier, they are highly effective with very few pregnancy reported. It has a long duration of action, a fit and forget method as we call it. It is reversible. There is no evidence of delay in return to fertility. It is very convenient. It requires a small procedure which can be done at most GP surgeries. It results in a reduction of menstrual problems such as painful heavy periods. The problems with progesterone only implants: it can cause sometimes irregular bleeding in certain women, but as we said earlier, this declines after the first year and women should be counseled about that. Changes in weight, mood and libido have been reported. However, these are only associations which are weak. We come to the next one, which is intrauterine contraceptive devices, commonly known as copper coils. They are called IUCDs. They are safe and effective methods of contraception. Evidence suggests that the copper coils, as they are commonly known, are better than combined oral contraceptive and are as effective as sterilization. The most effective devices are T-shaped copper coils. IUCDs also have a thread that is left to permit checking and allow for removal later on. So how does it work? The fertilization is prevented by the effect of the copper on the egg and the sperm. It reduces penetration by the sperm due to the effect of the copper on the cervical mucus as well. The lining of the womb gives an inflammatory reaction and hence prevents implantation. So what are the benefits of this? As we mentioned, it's a highly effective form of contraception. It's reversible and it's convenient. As we said, it's long-acting, fit and forget. It's effective directly following the fitting. As soon as it is fitted, it is effective. It can be used as a form of emergency contraception as well. There's no hormone involved and it reduces the potential for risks and side effects from hormonal contraceptives. It is effective for up to 10 years and it also reduces the risks of endometrial cancers. So what are the problems with copper coil? Some women find that the insertion is unpleasant. Spotting and bleeding between periods can occur. Many patients request removal within 5 years for that reason. Occasionally, there might be pelvic pains. The periods can be heavy, particularly in the first few days. Displacement or expulsion can occur. 1 in 20 women have reported that it has moved in its place. Increased risk of a pelvic inflammatory disease. Uterine perforation, which is a hole in the uterus, that has been reported in 2 women per 1,000. Ectopic pregnancy, most commonly talked about. The absolute risk of this is low. However, in pregnancies which occur while the coil is in place, up to half of them can be ectopic pregnancies. We come to the last one, which is the levonorgestrel intrauterine system, or commonly known as Mirena or Jadis coils. They have been licensed in the UK since 1995. There are 2 types, as I mentioned, Mirena and Jadis. They are both T-shaped devices for intrauterine use, which means they are inserted inside the womb. Mirena is effective for 5 years and Jadis is effective for 3 years. Mirena is also used for management of heavy periods, also known as menorrhagia, and it also has protective effect on the lining of the womb. It can be used as a form of HRT alongside another estrogen patch or pill. So how does it work? This mainly acts by reducing the growth of the lining of the womb and preventing implantation. The lining of the womb becomes thinner. The progesterone effect on the cervical mucus makes it difficult for the sperm to get into the cervix. Ovulation occurs normally as usual. So what are the benefits? It's very effective. it's convenient, and it is reversible. As mentioned earlier, it can be used for heavy periods known as menorrhagia and dysmenorrhea, which is painful periods. It may reduce the risk of pelvic inflammatory disease as compared with the copper coil. It does not significantly interact with other drugs as the action is predominantly local. The hormone is secreted locally. There has been no effect on the bone density. So, what are the problems with these coils? As mentioned earlier, some women find it unpleasant at the process of insertion. Menstrual irregularities can occur in the first 6 months. There are typical effects of the progesterone, which include acne, breast tenderness, occasionally headaches, and some mood changes, which might limit its use. Ovarian cysts, however, these are of no consequence and resolve spontaneously. As we mentioned earlier, absolute risk of ectopic pregnancies is low. However, if a pregnancies occur, then the risk might be higher. Expulsion or movement of the coil is common, possibly similar to the copper coil. The risk of perforation again is 2 women per 1,000. It may be higher in breastfeeding women. Thank you very much.